everyone, it is me Pranav Pinar and you're watching me on my channel Pain Se Gain Tak. So today we are here to discuss one very important topic, that is the pathogenesis of acute rheumatic fever, which is a very important topic both for your university examinations and also for your competitive examinations like NEET PG and INSET. So without wasting much time, let's begin our video. So pathogenesis of acute rheumatic fever. The age group that is going to be most commonly affected by this disease is the age group of 5 to 15 years. So 5 to 15 years, this is the age group that is going to be most commonly affected by the Streptococcus pyogenes. Now what is the causative organism? As I have mentioned, the causative organism is the Group A beta hemolytic streptococci. It is also called by the name Streptococcus pyogenes. It is also called Streptococcus pyogenes. It is called Streptococcus pyogenes, or it is also called Group A beta hemolytic streptococci or Streptococcus pyogenes. Now, what is happening over here? In 5 to 15 years of age group children, the Streptococcus pyogenes is going to be affecting the tonsils and pharynx. Tonsils or pharynx. And the child is going to have tonsillitis or pharyngitis. Now, this Streptococcus pyogenes is going to be affecting the tonsils and pharynx, and the child is having tonsillitis or pharyngitis. Now, the antigen presenting cells will be taking the Streptococcus pyogenes and will be presenting it to the immune complex. Now, whatever immune complex will do, automatically it will be producing antibodies against the antigen. Now, the antibodies are produced against the Streptococcus pyogenes. Now, in 97% of the lucky population, everything is going to be normal, where the antibodies produced against Streptococcus pyogenes is going to be affecting the Streptococcus pyogenes, killing the Streptococcus pyogenes, tonsillitis or pharyngitis will be solved. But there comes a 3% of the unlucky population, where the Streptococcus pyogenes are also affected along with our own cells. So, in 3% of the unlucky population, the antibodies that are produced against Streptococcus pyogenes is going to affect Streptococcus pyogenes along with our own cells. Now, this is because of an important phenomenon known as molecular mimicry. Molecular mimicry. So, what is this molecular mimicry? When we are checking the structure, the cell structure of Streptococcus pyogenes, we can see that in the cell membrane of the Streptococcus pyogenes, we can see a proteinaceous structure called M protein. This M protein is having a molecular similarity with the proteins present in our heart, joints, subcutaneous tissue, skin, and also in our nerves. Now, the Streptococcus pyogenes, the antibodies produced against the Streptococcus pyogenes is going to affect also the tissues of heart, joint, subcutaneous tissue, skin and nerves, and will be producing multi-complex or multi-system damages, and that is going to be non-suppurative. That is what non-suppurative damage is going to produce. What is non-suppurative? There is no formation of pus. So, no formation of pus will be seen, and the organs affected are heart, joints, subcutaneous tissue, skin, nerves, and that will be producing different clinical conditions or clinical symptoms in different parts or the different systems of our body, and that's the clinical symptoms we will be discussing in the next part of our video. So, this is only going to affect the 3% of the population, and this will be causing acute rheumatic fever. Acute rheumatic fever, and that is because of a phenomenon called molecular mimicry, which is what? Which is basically the similarity of the M protein, that is the structure present in the cell membrane of Group A beta hemolytic streptococci or the Streptococcus pyogenes, which is very similar to the protein or the structures present in our heart, joint, subcutaneous tissue, skin and nerves. And that is acute rheumatic fever. So the next part of the video we will be discussing about the clinical features and also the diagnosis of the acute rheumatic fever using Jones criteria. So till then, it's me Pranav Pinar signing off. Bye bye.